Hey, welcome back to Nursing with Bonomi. It's Ben the RN here.
I'm Nurse Nay.
So today we're going to combine our two experiences working both acute care and long-term care, and we're going to be talking about some of our tips for the MedPass. So stay tuned for a great video. I've been a registered nurse at the bedside for most of my nursing career, working acute care. I've worked in a couple of different hospitals in the greater Cincinnati area, and I got my start working in a level 1 trauma center on a medical unit, working night shift. And so it was really important to have a good time management when it came to doing your MedPass. And something that I learned is prioritize your medications. After you finish report, you want to make sure that you look up what medications that your patients are on. Most of you guys are going to be using Epic or some other form of electronic health record. And so think about your antibiotics. Think about, do I have any patients going to dialysis? What medications do I hold, or what ones do I give for dialysis? Is anybody going for surgery? Whether you're working night shift or day shift, that's something that may happen. There may be emergency procedures, or you may have a patient being picked up by surgery at 6 a.m. So you want to make sure that you hit your priorities when it comes to your medications. And I would really recommend try to do bedside report. Don't be a change resistor, because this is something that I believe works really well, and it can be kind of hard. There are going to be some nurses that have been doing it for 20, 30 years. Oh, this is how we've always done it, where they just give report at the nurse's station and then they go to see their patients later. But if you give bedside report, you can look at the MAR and say, hey, they have this medicine coming up due at 8 o'clock. And that can be really important. So just because that's the way they've always done it doesn't mean that there's not room for change, because they didn't used to wash hands either or put on gloves. So, think about the logic with that. So we don't practice nursing like we did back in the 1890s. That's not safe practice anymore. So those are a couple of ideas. Prioritize your medications. If you have 4 to 7 patients, depending if you're working on a step-down unit or if you're working med-surg, prioritize your patients. There's kind of a way to look at it. You can choose your easiest patients first, or you can do your easiest patients last. But of course, if someone is a high priority, if they're getting those antibiotics, if they got procedures going on, you want to lay eyes on them first. And if you do your bedside report, you've already laid eyes on them, and then that way you kind of know, hey, which one do I want to circle back around to and see first after I'm done with report on the rest of my patients. So prioritize and try to do your bedside handoff.
And I have some specific ideas to help with the long-term care side of things. Usually have 20 to 24 patients, especially if you're working night shift, and 20 to 24 patients in the long-term setting, even if you're on day shift, like 15 or less if you are working in the rehab side. But particularly for night shift, it's really important to prioritize like the types of patients you give meds to first, because you never know what might end up happening and you're going to be late on your med pass for whatever reason. I would try to prioritize to get my alert and oriented patients first, and then kind of prioritize my confused patients. And unless you're not going to want to wake them up type of situation, because they're not going to fall back asleep, then you want to get them. So just kind of prioritizing the patients you do, not necessarily doing them in the order that they come on the hallway. And then also, since you're going to have so many patients, you may have a patient who gets, say, 2 different eye drops, an inhaler, they might have insulin, and some oral meds. So what you can do for that, because you need to wait 5 minutes between each eye drop, give one eye drop, then do everything else, and then that might end up being 5 minutes if you have to take their vitals and everything too. Then you can give them their last eye drop after that. If you have somebody who has multiple eye drops, which is annoying, very annoying,
yes.
But they might have like up to 5 different kinds of eye drops or more. So you can go give them their eye drop, go get another person their meds, give the first patient their other eye drop, then go get another patient their meds, and just kind of go back and forth like that instead of just standing there waiting for 5 minutes. Put the smallest amount of applesauce or pudding in the cup for your confused patients.
And guys, this reminds me, if you are crushing calcium and putting it in applesauce, it will expand really big. So make sure to use an even smaller amount of applesauce if you're going to be putting calcium into it.
If they take those little nibbly bites, sometimes you just open your mouth. Sometimes I'm like, open your mouth really big. And I actually do that. Because some of them are confused and they don't get it. But when you do that, they open their mouth. And yeah, so you'll figure out your own tips and tricks. But using some of ours can be helpful, hopefully. And let us know in the comments.
Oh, I had another.
Do you have another tip?
Yeah, I have another idea. And so, especially working in the long-term care setting with up to 24 or maybe even more patients, you don't get very much time to interact with your residents. So that may make you feel really unfulfilled. But even those brief little interactions, you go in there and you smile and you say, "Hi, it's so good to see you again. I have your medicine for tonight." Instead of going in all grumpy and sour, well, that can make you feel good and make you feel like you're getting some meaning out of it. And you know that you're doing, even though, you are just, pretty much giving pills like a medication aid could do. Whoop-de-doo, right? But, it gives you some more meaning. And even in the hospital, too. When you're doing that, you may have a little bit more time to spend with your patients, maybe not. But, incorporate a little bit of kindness and a little bit of a smile into your day.
So let us know in the comments below if you guys try any of these tips, if you have any other tips that you use in your practice, and share the wealth of knowledge so we can all help each other out.
Yeah, and make sure to share this video with your friends in nursing school, with your colleagues at work, and let's get on the Nursing with Bonomi bandwagon.